Hello and welcome. I'm Anna Maria Tremonti, the host of this J Talks Live series and the host of the CBC podcast More. Now, today we are speaking with one of Canada's leading health journalists about covering COVID-19, including what it took in the early days to sift through the fast-moving and overwhelming amount of information to bring accurate news to the public, and what it still takes in these days to do that. But first, the Canadian Journalism Foundation wants to thank the J Talk series sponsor, BMO Financial Group, and in-kind supporter, Cision, for their generosity for letting this happen. And we want to provide you with some helpful notes about this webcast. If your internet quality is poor, click on Switch Stream, and the video quality will decrease, but the audio should remain the same. If you're having technical issues, you can click on Request Help, and you can find that in the top right corner of the webcast page. Someone will respond at the email address that you provided. Now, the webcast is going to be 40 minutes long, and I'm going to chat with our guest first before taking your questions. But feel free to submit your questions at any time during this at the questions tab. And we already have some questions. They're starting to pile up because there's a lot of interest, of course. And if you want to tweet about this, please use the hashtag JTalksLive. Now, let's get to our guest. André Picard needs no real introduction. You know who he is. He's the health columnist for the Globe and Mail, a longtime champion of public health. He was one of the first calling for strong social distancing measures. André, thanks for joining us. Welcome.
Thank you.
And I want to thank you for your work, because your work has been tireless and really important right now. So thank you.
Thank you.
Maybe we can start just by hearing about the scope and the challenge of covering a pandemic when you're in the midst of it, when you can't travel, when good information keeps getting updated and bad information keeps fighting for attention.
Yeah, it's really the first pandemic of the internet age. So there's just this constant bombardment of facts and non-facts as well, and opinions, and just it's hard to keep drinking from the fire hose. So you have to find ways, I think, as a journalist, to really focus on what's important, one issue at a time, for example. That's how I do my columns, and try and not be overwhelmed by the numbers. I think as journalists, we get a little too caught up in the hour by hour or minute by minute change in numbers, and we really have to look at trends more than numbers.
When this pandemic began, André, what were your biggest concerns?
Well, I was looking back because I knew we were doing this talk today. So I looked back, when did I first start writing about coronavirus? And it was in mid-January. In mid-January, my concern, like I think a lot of people in public health in Canada, was, oh no, is this another SARS? Because Canada was really hard hit by SARS. Only two other countries in the world were harder hit than we were, and we made a lot of mistakes. So I wrote right in mid-January, this is looking worrisome. It was in China. There were only 200 cases at the time, but we already knew that this had the potential to become another SARS, and that we couldn't afford to make the same mistakes that we made back in 2003.
And as you go forward now, and you look at how this pandemic has progressed in Canada, what has surprised you?
Well, I think is surprising how it's a bit different from SARS. You know, we kind of thought a coronavirus once, another coronavirus, we can handle this, but it's a much trickier virus. It hides a little better. SARS was quite deadly. You know, there's a paradox with viruses. Either they're really deadly and don't spread that easily, or they spread very easily and they're not that deadly. And this one, the COVID-19, is kind of right in between. And this is something we've never really seen before. It's fairly deadly, but it spreads quite readily.
And so where do you go for your best sources? Give us a little more insight into how you sort through all of this as you try to report it to the rest of us.
Yeah, so I'm a big reader. I like to read other media. So I start early in the morning reading, papers from around the world. I think it's important to look beyond Canada and the US. The US, once coronavirus hit there, it becomes an overwhelming source of news and information and misinformation. So I think it's really important to look to Europe You look to Asia, and that's one of the beauties of the internet age. I talked earlier about some downsides, but the upside is we can really get information from all over. We have pretty direct access to some of the world's top scientists. So, they're right on Twitter. You can talk to them, and they've been really good about sharing information about this with journalists. So it's a lot of reading. It's a lot of talking to people. I always say the most important people in my stories are not in my stories. They're the people who give me background and information, help me understand things that make me look semi-smart, but it's all people in the background doing this.
And what are the best sources of data on COVID deaths and caseload in Canada?
Well, there's, you have to go to the official sources, to the Public Health Agency of Canada, to each of the provinces. We're very decentralized, so that's frustrating, but there's been some good compilations. Radio-Canada has one of the best maps. They track the virus in real time. Now, I don't recommend people in the public do that. I don't think it's useful. I think it's kind of useful for journalists to follow this. I try and take a snapshot of the numbers once every day, and I've kept that track of that all along, and it gives me a sense of the progression and the epidemic curve, et cetera. And then internationally, there's some really good maps, Worldometer, Johns Hopkins. These sources, again, do live real-time tracking.
Long before this pandemic, you were reporting on the deficiencies of long-term care homes across Canada. And I wonder if we can talk a little bit about what you have seen happen over the last couple of months now.
Yeah, so I think that's the big frustration, is that this was one of the earliest predictions. Well, we know who's most at risk of any pandemic illness, any viral illness. It's older people, especially in institutional care. So we knew this was going to be the biggest risk spot. We wrote about this very early on. As early as February, we're writing, listen, we can't afford to ignore nursing homes and long-term care. But it happened. We just didn't prepare ourselves. And I think more than anything, this pandemic has exposed problems that already existed, as opposed to creating new problems. Every problem that's killing people in nursing homes, in long-term care, existed before this virus came along and caused all kinds of problems. Fires, I remember writing about really deadly fires in nursing homes a decade ago. And I could take those columns today and replace the word fire alarm for COVID-19, and it would apply word for word. All the same problems exist: a lack of staff, untrained staff, lack of prevention, a really bad structure, etc. So all these things were predictable, unfortunately.
That's really telling, that it's in some ways what you're saying. It's less about the pandemic and more about both governmental and societal choices that we have made in how we treat elderly in care.
It really says a lot about the lack of value we place on the life of older people, especially once we ship them off to this institution, to this warehouse. And I hope, my big hope is that's a big change that comes out of this, is that we realize the folly of the way we treat our elders.
Well, and let's talk about that a little bit, because we are seeing governments. Ontario has changed some things, but we know that in the case of Ontario, comprehensive inspections were not happening. We know that across this country, workers in these homes haven't been able to make a living wage, which is why they go to other places to work as well. Do you see a real reckoning, both on a policy level and maybe even on an investigative level, for whoever runs some of these places? Do you see a reckoning coming somewhere down the line?
I hope so. We're overdue for a reckoning. We've had many, many reports over the years talking about these things. In Quebec, which is the hardest hit, the nursing homes, people are getting paid as little as $13 an hour for really, really hard work, physically, mentally difficult work, taking care of people, changing their incontinence pads, bathing them. This is really hard, difficult, but essential work. And we've never valued it. What we've done is the opposite. We've said, we're going to pay you a minimum wage, and we're only going to give you part-time work, so we don't have to pay you benefits. And then, then you'll have to work in 5 or 6 homes or have 10 different clients. And all these things, all these structural issues have created the perfect storm for a virus spreading. And, I've said this before, you've heard me talk about this as I harp about this all the time, that all the problems we have in healthcare are structural issues and administrative issues. And again, we're seeing this with the epidemic. We're really good at the medicine. Once people are sick, we're good at fixing them. But it's the keeping them healthy. It's creating a structure that people are not at risk, where we really fail.
And as you track this pandemic, what are you seeing in hospitals that has really stopped you?
Well, I think we've prepared well in hospitals. The main reason is SARS was really a nosocomial disease, meaning a hospital-based illness. Everybody who died of SARS was related to a hospital outbreak. That's where we really failed the last time. So our hospitals are really well prepared. With very few exceptions, Quebec has a couple of hospital outbreaks, which is really worrisome. But elsewhere, our hospitals are eerily quiet. We emptied them out to be ready, stopped all elective surgeries. Our emergency rooms are virtually empty. People are scared to go to them to a degree that's disturbing, I have to say. So hospitals are really well prepared, almost over-prepared, and then long-term care is under-prepared. And we have to get that balance right.
And what are you seeing right now in terms of PPE, of the equipment that hospitals need as this pandemic continues?
Well, there's been some definite failings there. We didn't have enough stock. We had, again, from SARS, it's a familiar pattern that happens. There's a crisis. We get a really bad report, slap people on the wrists. We do all this stuff for a few years, and then we kind of forget it. We get lazy, and then we cut public health again. We forget to restock our emergency stocks of masks. We figure out that they were all expired and they don't work. Again, this is all stuff that was preventable, but we get lazy in between. We forget. We have very short memories, unfortunately, in politics and in public health. So the PPE question was all about, we knew everything to do. We had the stocks, but they just weren't updated. And that's probably what cost some people their lives, unfortunately.
When we talk about testing, Andre, there still seems to be not a clear path forward for more widespread testing. What kinds of questions are you asking?
Well, testing has been a hard one all along because it exposed a problem that existed again before the virus, this lack of reagents in labs. So we just didn't have the chemicals, the base products, to be able to scale up as quickly as we wanted. So there's a lot of criticisms of governments, different provinces. You didn't scale up fast enough, but there were some real technical issues, unfortunately. Now most of those are resolved. A lot of private labs, university labs have kicked in. So we have tremendous capacity to test, but we have to keep ramping it up. The chief public health officer yesterday said that before Canada thinks about getting back to normal, we have to be doing at least 60,000 tests a day. We're doing 20 now. So we have to triple what we're doing. And we're doing a lot now, but we really have to pick it up if we want a sense of what's really going on in society. And we don't know that yet. We know the confirmed cases, but we know that those are a tip of the iceberg. And the real unknown is, how big is that iceberg underneath? And we don't know.
And just in line with that, and I will ask about getting back to normal a little later, but just in line with the actual numbers, we also know people can be asymptomatic. So in terms of what we know about this virus, and how it actually moves through a population, there's still some big unknowns, are there not?
Yeah, you have to consider this is really just 3-4 months old that it's been in the general population. So there's a lot we don't know. So the big question is, how many people in mainstream society have been infected, were a little bit sick or not sick at all, but have developed some sort of immunity? So that's the big unknown question. Now we're starting to get studies from around the world, from countries that are ahead of us on this. And the news is actually quite alarming, I would say. A lot of these studies are showing that only 2-3% of the population have been infected. Now, that you might say, oh, that's a good thing, right? But actually, it's a bad thing, because what our ideal would be, a lot of people have been infected and didn't get sick, and they're never going to get sick. So we still have the vast majority of the population that has the potential to get sick. So when we talk about reopening society, then means more interaction, more chance of disease spreading. And then we have the potential for another big wave. And we're starting to see this in some countries like Singapore, Singapore has been cited as one of the ideal reactions. They got this under control quickly. They had very few cases. And then all of a sudden last week, they were getting back to work. They had double the cases overnight because so few people had been infected, so few had immunity. So then it started to spread, and then they had to lock down again. So that's the future we have to be ready for, that if when we open up, things blow up again, we're going to have to shut down. And I think it's going to get more difficult every time we try to do this.
I was going to say, now this is the very thing that we are expecting our public health officials and our elected officials actually to confront, right? I mean, people are already asking, we see it across the border even more so, but people are asking how long. We see it in certain provinces. There's an effort to get back to normal or to open up again. But how should people be weighing this, the people who have the decisions to make, be weighing this?
Well, I think most of them are talking, at least saying the right things. They're saying this is going to be a gradual return. We have to try and do things slowly to see what happens. It's going to be trial and error. I think we also have to realize that we're not going to return to normal. It's going to be a new normal. This notion, I think something like the notion of 25,000 people going to a professional hockey game, I don't think that's going to happen for years now. I just don't see that being viable. People don't like to hear that, but that's the reality. Kids going back to school is going to happen relatively soon. But if they start getting sick, we're going to have to just change schools fundamentally. We're going to have to shop differently. This idea of us all crowding into Walmart on Saturday afternoon, I think we're going to be a long time where we're following the arrows around one at a time and limiting store attendance. These are going to be new things that we just have to adapt to as normal.
You talk about that kind of distancing, and I can't help but think about, right now, what that distancing also means. There's a real emotional side to it. And we see that with people who can't go to funerals, both in the case of people dying from this and the long-term care home deaths, and even the massacre in Nova Scotia. This is really hard for a lot of people on so many levels.
Yeah, it's really challenging. What the funeral shows is really changing our social norms. So this notion of mourning for us is not only psychological, but it's physical. You hug people, you cry, you share these emotions, as someone speaks. Suddenly, we can't have gatherings of more than 5 people at a funeral. How do you do that? It's going to change. It's going to change how we react. It's going to change how we deal with trauma. It's going to affect our mental health. So again, there's going to be all these secondary consequences, and they really come to the fore when you have a real tragedy like the mass shooting. This is something where we want to, as a nation, get out there and mourn, and we can't, and it's frustrating.
We know from your work that you are not shy about questions of accountability, but you have made it clear that you believe many people are being too harsh in their judgment of public health officials right now. Why is that?
I think you have to blame people who have power. I think it's really unfair when someone doesn't have the power to act to say they should be responsible. So this goes back again to SARS. I hate to keep going back to that, but a really fundamental recommendation out of that big SARS report was that we have an independent public health agency. So we created the Public Health Agency of Canada, but it was supposed to report to Parliament. It was supposed to be independent from government. The chief public health officer was supposed to be all powerful, but we didn't do that. In Canada, we tend to implement these reports with half measures. We cherry pick them. So what we have now is we have a great chief public medical health officer, Dr. Theresa Tam, but she has virtually no power. Her power is to advise. So if your only power is to advise, how can you be blamed for decisions? You don't have any decision-making power. So I'm all for holding people accountable, but only when they have the ability to act. So I think there's been a lot of really unfair commentary about her. There's almost an organized attack against her now from certain groups like the Rebel media group, very right wing. And I think it's really unfair, and it's tinged with this misogyny and with this racism that makes it even doubly disturbing. People saying, oh, does she work for Canada or does she work for China? Well, of course she works for Canada. Of course she follows the recommendations of the World Health Organization. It's the top public health body in the world. She's the top public health official in Canada. There's no scandal there that she would follow their recommendations. And I don't understand this hatred that's built up against Dr. Tam.
Where do you think the Canadian government needs to be more forthcoming?
Well, I think they have to, we were slow with testing. We have to admit that. We know a lot of stuff in retrospect, in hindsight. So I try to be careful to not criticize people for acting on the information at the time. But I think we were a bit slow to probably close our border, especially with the US. Now, there's a lot of economic consequences to that, but we know that our cases in Canada didn't come from China. They came from the US. The vast majority is because of Canadians coming back from the US. We were a little loosey-goosey with them, saying, if you don't feel well, come and get tested. But everybody should have gone in isolation who had traveled a lot sooner. So I think that was our big mistake. I'm, as someone who writes for a national publication, often frustrated by the differences in rules around the country. So I think the federal government could have done a lot more to use its moral suasion to tell the provinces, listen, let's have one clear message on this question and, not 14 different messages. So that's a little frustration, not a big deal in the grand scheme of things.
Where do you see a good policy making a difference in this country? You look at the curves with other countries. Where do you see things kicking in the way they should?
Well, I talked about Singapore as a country that's been held out as an example, Taiwan, but these are countries that have very different cultures. The measures they took were really oppressive, really quickly. I'm not sure they would fly in a democracy. So I look to South Korea has done a good job. It's a democracy, but again, a different culture where people are very, very obedient. The notion of protesting, a lockdown, unthinkable. Germany's done a good job, but Germany was really good with testing, with treating early, with tracking people. So there's a lot of good examples that we can learn from. A lot of countries can look to Canada. We were pretty good with testing early on. Within the country, I think there's some really stark differences. British Columbia, time and time again, has been held out as a model. And I think, Dr. Bonnie Henry has sort of become the voice of reason in this pandemic, and I think for good reason. But again, when I compare Dr. Henry to Dr. Tam, who gets all the criticism, Dr. Henry has a lot of power. The legislation in BC is well done. She's the boss. She speaks, she issues public health orders, and the politicians follow her lead. And that's how it should be. Public health should have the final word. People don't like that notion that a bureaucrat, which should have the final word, but that's how the countries where have been most successful, the provinces have been most successful. That's how it works.
You made the point that maybe Canada was too slow to close the border. Do you worry that Canada will be too fast to open that border with the US?
Well, I think the pressure is going to come from the south, not from the north on that one. So Canada, President Trump he muses on different things every day and changes his mind. But a couple of weeks ago, he was already talking about, we've got to open the border before May. Now that's, I think it's May 21st now is the tentative reopening. So that's a few weeks off. And I think it's not going to be a full reopening, right? We're not going to open the floodgates. We're going to have certain people can travel, et cetera. I think all these things are going to have to be gradual to see how they pan out.
Well, I want to talk to you a little bit more about that then, just in terms of what the new normal might look like and how we might start to go there. What steps do you think would happen first? And any idea of when you think they would do that? Are you at all concerned they might happen too early? Or?
Yeah, well, I think in Canada, it's interesting because we don't have one outbreak. We have a variety of outbreaks in different parts of our very large country. So Ontario, Quebec, 90% of the cases are there. So they're a very different issue. So we already hear PEI, Saskatchewan saying May 1st, we're going to start going back to business. That seems quite reasonable. They haven't had new cases. Almost all their cases are cleared. So I think it'd be interesting to do it that way and have almost these live models for other provinces to look at. What'll happen first? I think it's really important that we have to get hospitals back operating, doing their everyday stuff. operations, cancer care, diabetes care, all that stuff needs to ramp up because our hospitals are actually fairly empty. So that would be a good place to start. Kids back to school, that's going to happen to some degree. We know that kids generally are not getting very sick from this, so we can probably a good place to start. Gradual reopening of businesses, we're already seeing that. So we have food stores, pharmacies open. Now it's starting to be gardening centers, etc. So I think a gradual reopening of economic activity. This is all going to happen in stages. But again, we have the advantage of being a little late in the pandemic, so we can look to other countries. I'm really fascinated by Denmark. Denmark has had kids back to school for 2 weeks now. So no explosion of cases. So that's good, because we worry about kids being vectors. They don't get sick, but they carry germs around, as every parent knows. So if things are going well in Denmark, that's a good sign that maybe kids can get back to school sooner than we thought.
I'm going to go to some of the questions from our audience, because there are some post-COVID questions that dovetail with some of what we're talking about now. M. Dryden writes, if cures, vaccines, etc., are not found, how should a healthy mid-70s person plan to live for the next 2 years? It's probably better to plan for 2 years of isolation rather than be eternally hopeful and repeatedly disappointed, he writes. What do you think of that?
Yeah, so the first part of that I think is important. We don't know how long it'll take to have a vaccine, but people are saying best case scenario is probably 18 months, if ever. We have to remember there's never been a coronavirus vaccine. Pretty tricky virus. It can mutate a bit, so we have to be cautious about putting all our hopes in a vaccine. So hopefully that comes. If it doesn't, what we have to hope for is people gradually getting infected, developing immunity, and not getting too sick. Now, for the person asking the question is saying older people in particular, they are slightly more at risk, but we have to remember it's not age that puts people at risk. It's having other conditions. You know, if you have conditions like asthma, obesity, etc., cancer, those are the things that put you at much higher risk rather than just age. So I think I wouldn't hope that people are going to have to be in isolation for 2 more years. But I think people have to plan for living a little bit differently, not going to the movies the way we used to. Maybe Netflix will become important. Not going to hockey games with 20,000 people. Going to school concerts where maybe we all sit 3 seats apart instead of being crowded in. That's going to be the reality for people regardless of age for a little while.
What about transit in big cities?
Well, we're going to have to figure that out. Some countries, some cities have already made masks mandatory on transit. I could see that being the reality. Hopefully we won't just abandon things like public transit and have everyone flooding back to their cars. You know, one of the great benefits of this pandemic is we have the cleanest air we've had in a century. People, I love seeing a story the other day about an Indian village 100 kilometers from the Himalayas, saw the Himalayas for the first time in 50 years because there was no pollution. So we have to try and snatch on to some of these benefits that we've gotten out of this rather than just returning to doing things differently. So something like public transit, I don't think the answer is going to be people not taking buses. I think it's going to be having twice as many or 3 times as many buses and living differently.
Now, you touched on mental health briefly earlier, and Erica M. has a question, and I think she's asking about now, but I want to kind of make it now and later as we move forward with this too. What are your concerns about mental health with this long-term lockdown for families and ideas on solving the problem? And as of course we know, mental health isn't just going, even if we confront it right now, it's a long-term issue. So how do we think about that?
Yeah, so a couple of things. One is I think it's important that people with severe mental illness now have been neglected. So we have to get back to giving that standard everyday care because there's some of the people who have suffered the most. So that's important. Get our hospitals, get our health services back operating almost to normal. The more long-term consequences, I think, are unpredictable. I think we know through history that people are incredibly resilient. We survive all kinds of things: earthquakes, floods, fires, mass shootings. People adapt and they get over things and they adjust. So I don't think we have to be careful not to pathologize all our emotions in this. Some of us are sad, some of us are angry, but that's not mental illness. That's emotion, and it's a good thing. So we have to find ways of remembering, how to express ourselves differently. How do you let off steam when you're stuck in the house with your kids, frustrated 24 hours a day? So we have to, again, it's all about adapting to a new way of doing things. I think a lot of us are going to probably maybe work at home permanently after this. It's worked out pretty well for a lot of businesses. So how does that change the family dynamic? How does it change how daycares operate? So there's going to be a lot of consequences on this, and they're not going to all be bad. So I worry about people's trauma, their PTSD, especially people on the front lines. But I don't think it has to be a tragedy if we have means of expressing ourselves and talking about this and being resilient.
I want to talk a little bit about, you just mentioned people on the front lines. I'm wondering how our policies on public health and overall healthcare in terms of doctors, nurses, other healthcare professionals will change, you think, as post-COVID?
Well, I think that hopefully the most important change will come for the so-called low-skilled workers. I think we've realized more than anything else during this pandemic that these aren't low-skilled workers. These are essential workers. They're just low paid. So I think there's going to have to be some correction there, paying the PSWs, the orderlies, the janitors. They've been so crucial to keeping our hospitals safe, and our hospitals are incredibly safe. So it's not just about doctors and nurses, but it's about the whole staffing. And again, this is an issue I've written about for many, many years. We just don't have a coherent human resources strategy. And that became obvious during the pandemic. And again, it's something we should have solved long ago. And this perhaps gives us an excuse to do it.
Susan Palmer is asking, should medical assistance in dying MAID rules be temporarily amended to allow those who are potentially denied scarce ventilators or voluntarily choose to forego a ventilator in the context of COVID-19 to access medical assistance in dying?
Yeah, so there've been a couple of jurisdictions which unfortunately said, we can't do MAID because of this crisis, but they're a very small minority. So I think the palliative care folks have actually been quite excellent in this pandemic from day one, saying we have to think about these things. I don't know the data. We're not good at real-time data in Canada, but I don't have a sense that MAID requests are up in any way because of this. The way the illness progresses, the way it progresses really quickly, there's not a lot of opportunity for MAID, unfortunately. So people die quickly once they degenerate. So MAID becomes kind of a side issue, and it's mostly important for people with other conditions. So we still, all the people who have cancer still have cancer. They're still dying of cancer. And as far as I know, they're still getting their MAID when they want it. And that's a good thing.
I'm going to keep going with some questions here, Andre. This is from Michael Benedict. Since at the time of writing, April 15th, half or more than half the COVID-19 fatalities have occurred in senior citizens' homes, to what extent should these numbers impact public policy, which affects the wider population that does not live in the homes? In other words, is not the fatality rate for the general population at least only half of the overall numbers? If so, what does this tell us about how one should be combating the pandemic?
Yeah, so I think there's two things there. One is it tells us we've done a terrible job of protecting people in institutional care, so they have had a disproportionate number of deaths. The implication in the question is one that people have asked from day one. Should we have just locked away older people and then let others go about with their lives, sort of like they've done in some countries like Sweden? And the answer to that is that it's not turned out any better for them than for us. So they had a little bump there at first where it looked like it was a great strategy. Now they've had a big increase in deaths. So this question about, does it just affect older people? The answer to that is no. A lot, more than half of people getting very sick are younger. It's just the mortality. So we have to be careful not to make public policy just based on mortality. That's just one data point. The number of people getting sick, the number of people who are going to be disabled permanently because of this, we don't know yet, but these are going to be significant numbers. And again, you can't just lock away older people or people with chronic conditions in society because they're an integral part of family life, of social life. If you do that, you just kind of say, oh, let kids infect them and they're going to die. It's kind of a crude culling of the herd if you have that attitude, I think.
A question from Joanne Filion. With the Prime Minister announcing the creation of the Immunity Task Force, what are your views on this initiative, and do you have any recommendations for them?
Yeah, so new stuff just this morning. We don't have a lot of details yet, but it's something that we've known is the next step. We have to figure out who can go back to work, what are the standards. And I wrote about this earlier this week about their countries like Germany talking about having an immunity passport. So we start testing people. If you have immunity, you can go back to work. I think this is going to be a reality in the months and the years to come with this. Now, the challenges of testing, that the implication there is everybody's going to get tested eventually. And that's a big job. That's 37 million people, right, just in Canada. So is that going to come? Probably eventually, unless we get a vaccine, and that's the fast track to immunity. But in the meantime, we have to figure that out. Who are we going to test first? What does immunity mean? We have this assumption that once you've been sick, you have immunity and you're never going to get it again. But this is a tricky virus. We have some evidence of people getting reinfected, or maybe the virus just hides and it comes up again. We don't know. So there's a lot of unanswered questions about immunity, and that's why this task force is so important. They're going to have to really tackle those subtleties and figure out how we do this the most logical fashion possible.
In line with that, Faye Cohen is asking, can the COVID-19 virus change over time and become more virulent?
Yeah, so any virus can mutate. Some good news here is there's not a lot of evidence that this one is mutating very quickly. It's not like the flu. We know that we have to get a new flu vaccine every year because the flu mutates quite quickly. So we lose our protection. We need a new one every year. There's no evidence that happens with coronavirus. We have several coronaviruses that already circulate in society, about 4 of them, and they don't seem to have mutated. So that's good news. If there is a vaccine, it'll probably work, we hope, for a fairly long period of time.
And a couple of questions on the origin of this virus. Somebody asking you to address the conspiracy theories around it. And another question that says, I'm confused about the origin. I thought it came from the so-called wet market, or the farmer's market in China, which sells live animals for human consumption. If in fact COVID-19 and SARS started in this way, should the rest of the world insist that China ensure it's not repeated?
Yeah, so there are a lot of conspiracy theories of this virus having been created in a lab, etc., bioweapon. But the reality is that the most logical, sensible science, if you read it, is that this is one of many coronaviruses that bats carry. Bats are really good vectors. They have an immune system that allows them to carry a lot of viruses without getting sick. It looks like this moved from bats to pangolins, this strange animal that is sold in markets in China. And then it starts infecting people, and it's a very similar route to the flu takes. The flu usually starts in swine, in pigs, it gets into people. So these are traditional routes for viruses. And it just makes sense that that's how it's gone about. The question of wet markets has been raised often. China has cracked down on them temporarily. We don't know if we'll do it permanently, but that's just one little aspect of a much larger story. But yeah, probably we have to deal with the wild animal trade and this, interaction between humans and wild animals living in close proximity. This is what's giving us all these new illnesses. And we've had many over the last few decades, and it's just an acceleration, and they seem to be getting worse, as we're seeing with things like Ebola and with COVID.
And, there have been a couple of questions as well on just trying to sort through misinformation and who to trust. And there's one here. Can you talk about the types of misinformation that have been propagated by merchants and influencers on platforms like Instagram, Shopify, et cetera, mainly to sell cures and supplements? how do people recognize that, I guess, and also just what's being done to stop them?
Yeah, so this is a growing problem. This is the dark side of the internet and the web, is people promote all kinds of stuff, miracle cures. I think the fundamental solution to this is we're going to have to teach, especially young people, how to figure out, how to distinguish sense from nonsense, how to track the source of information, etc. This is going to be an all-important skill in our world. The most gullible people in the world, unfortunately, are sort of people of my generation. So we're from the pre-internet era, and we kind of be the most gullible of stuff that's on Facebook and Instagram. So we have to learn too. But I think, there's just pretty basic tips. Anybody who's promising a miracle, you should write them off immediately. There are no miracles, there are no silver bullets here. People who are promising that some food stuff is going to magically cure a virus, you should be skeptical of in general. So I know about a lot of these things that are being sold. I hate to repeat them to give them any attention, but I think people owe it to themselves to be skeptical of pretty well any promise of a cure. You have to follow the science. The scientists who are unsure, who have a lot of caveats, essentially those are the ones you should trust.
And, we talked earlier just about people who are angry with some of the experts, but on the other hand, we live in a world where experts were really expert was almost a pejorative for a while here. Do you see a new appreciation of experts and science and scientists right now from other people?
I hope so, but I'm not sure. I think there is this disdain for expertise, in general, but it's hard to get a sense of how widespread it is. We know that, again, in the social media world, a small minority of people have a very loud voice. So we have to be careful to not fall into that trap of thinking that the people who are yelling loudest actually are a majority. They're not. They're a very tiny minority, and we have to figure out how to process the nonsense that they put out there, and to sometimes take some things that are true and incorporate them in our thought without adopting, a lot of far out stuff. So that's the real trick of people who like anti-vaxxers, is they take good science and then they just pervert it to the point where it's ridiculous, but there's some sound stuff in there, so it confuses us.
Well, it really matters to be talking to a journalist who has spent so much of his life working on this and helps us sort through so much. André Picard, thank you so much for your time and your work.
Thank you. It's been a pleasure.
Well, thanks you everyone for joining us for all of this. And if you want to mark your calendars for other events, on May 7th, I'm going to be joined by Nathan Vanderclip, the Globe and Mail's Beijing-based Asia correspondent. He'll share his perspective on the pandemic from China. On May 14th, Ian Hanaman-Singh will join me. He hosts CBC Television's The National from Vancouver. Ian's going to talk about the challenges for broadcast journalists reporting on COVID-19 and offer the view from British Columbia. And André was mentioning British Columbia and the differences there for some of the things. May 21st, Chantal Hébert, political contributor to the Toronto Star and the At Issue panel for CBC's The National, will talk to us about Canadian leadership and the response to the pandemic. And on May 28th, Heather Schofield, economics columnist with the Toronto Star, will speak about our new economic reality. There's a long tail on this pandemic and it affects all of these things. And so we hope you will join us for all of those as well. I'm Anna Maria Tremonti. Thanks for joining us today.